By the year 2030, the United States will face an estimated shortage of about 40,000 to 100,000 physicians. This includes primary care physicians, PCPs, whose demand is expected to increase by about 20%. Primary care plays a crucial role in our healthcare system, and this shortage has burdened society in a tremendous way. In 2007, the New England Healthcare Institute published a report on the inefficiencies of our healthcare system. They stated that the emergency department had become a primary care resource for so many people, while the system failed to meet its growing demand. Many of today's emergency room visits could have been treated or even prevented through regular and efficient primary care. This issue is on the rise and will continue to increase as millions of Americans are unable to access primary care. However, this issue is not due to our system being short-handed. It is simply because we are being inefficient with our current resources. Our system relies too heavily on physicians and not enough on mid-level practitioners, which includes physician's assistants and nurse practitioners. One of the quickest and most effective ways to solve this problem is to change the current scope of practice laws and shift primary care responsibility over to mid-level practitioners and in turn increase access to primary care. Now, not only will access to primary care increase with this change, the cost of services for providers and for patients will also decrease. In a study comparing the cost provided by a physician and a nurse practitioner, there was a $207 per beneficiary annual difference. Now, looking at this difference over a period of 10 years, insurance companies could save over $60 million if services were provided by mid-level practitioners instead of physicians. In fact, it has been proven that nurse practitioners achieve clinical outcomes and patient satisfaction similar to those of physicians. So, if decades of research and studies have shown that primary care is equally successful in the hands of nurse practitioners and physician's assistants, why hasn't this shift occurred? The answer is rooted in our current scope of practice laws, which explain the treatments and the procedures that medical professionals can provide based off their licensing. Current scope of practice restrictions have prevented medical professionals other than physicians from practicing to the full extent of their training and skills. In fact, nurse practitioners are trained quicker, cost less than physicians, and provide more flexibility within the healthcare system. They are fully equipped in providing primary care. However, due to these current scope of practice laws, are unable to do so, and instead have to sit back and watch as millions of Americans are unable to access primary care. These laws are a direct cause of our workforce shortage and the inflating cost of healthcare, especially in rural, undeserved areas. Our healthcare system even encourages physicians to practice in higher income areas simply because the cost of services are of a higher reward, leaving these undeserved areas unattended. Scope of practice laws reforms is the necessary step that needs to take place if access to healthcare system will increase. And this is also a necessary step for many other healthcare reforms. The shortage of primary care physicians is an issue that is on the rise and will not go away on its own. Change to scope of practice laws must occur in order for access to increase in our system. We need to shift responsibility over to mid-level practitioners and allow them to become primary care resources for many people. This is one of the most effective, immediate, and a really good use of our healthcare, of our current resources to solve this problem. Today is the time when healthcare reform and change must occur. Let us give responsibility over to mid-level practitioners to help our accessibility in our nation to increase, especially to those that need it the most.